Hi, I'm Dr. Belinda Morrison-Bligeon, consultant urologist here at the University of the West Indies and the University Hospital of the West Indies. Today we're going to be having a deep discussion and a very important discussion about low testosterone, also called andropause. We're going to talk about how common it occurs, what are some of the symptoms, why it happens, and how it can be treated. So stay tuned. The global prevalence of low testosterone is anywhere between 10 and 40% from reported studies. It's seen in about 4% of men in their 40s, about 5% of men in their 50s, and in the 60s the prevalence increases about 10%. But is it all just about aging and it's expected and accepted? No. Yes, testosterone levels decline with age, but it should not be accepted. Not only are the symptoms morbid and affect quality of life, but they can even interfere with life and lead to mortality. So low testosterone should not be ignored. The symptoms, though they occur with aging, should be treated. Have you been noticing that you have irritability, lack of energy, lack of interest in sex, erectile dysfunction? These may be symptoms of low testosterone. Low testosterone is a clinical and a biochemical syndrome that tends to occur with aging. It's also been called andropause, male menopause, or various things. But really, it's due to a lack of this important hormone called testosterone. Testosterone is considered a metabolic hormone, and it's important for a number of different things, for normal cardiac and metabolic functioning, but as well as sexual functioning. But as men get older, testosterone levels slowly decline. This can be seen from as early as the mid-30s. When the levels decline, some men will have symptoms of low testosterone. But what are these symptoms? Well, let's start with the sexual symptoms. There may be lack of interest in sex or less frequent early morning erections, lack of stimulated erections, lack of ejaculation or shorter duration of erections, and generally poor sexual health. But then there's a cognitive part, lack of ability to focus, irritability, being very anxious, and just not being able to think and think clearly. There are the metabolic effects, where persons may do labs and notice that their cholesterol levels are high. They may notice that they have hypertension, their sugar levels are high, they become obese, and they have the so-called metabolic syndrome. And of course, there's a cardiac effect where persons may have high blood pressure and are at risk for coronary artery disease. These are all part and parcel of some of the things that can occur with low testosterone. So it's more than just a sex hormone or a condition that affects sex, but it affects the general and the whole man. The importance of low testosterone is that if untreated for a long period of time, it may increase morbidity and can result in death. So if you have been having any of these symptoms, just brain fog as they call it, generalized fatigue, lack of energy, this conversation is for you, and you ideally should be checked, see your doctor to see if you may have low testosterone. Who is at risk for low testosterone and should be checked? These are men who have type 2 diabetes mellitus, so that's adult onset diabetes, men who may have HIV, men who have unexplained low blood count such as anemia, men who have low bone mineral density, persons who have been taking narcotics for a long time for various reasons, maybe for chronic pain, persons who take steroids for a long time for any inflammatory disorder, persons who have liver disease, those who are alcoholics, those who have end-stage disease for the kidneys or maybe on dialysis. All of these persons are at risk for low testosterone and should be screened. So how is low testosterone diagnosed? Well, it's a combination of the presence of symptoms of low testosterone plus low testosterone levels on at least 2 blood tests readings. But these tests must be done early in the morning, preferably before 10 a.m. on an empty stomach. So it should be a fasting test. So if a man has 2 successive readings that are low in the presence of symptoms, the diagnosis of low testosterone is made and treatment should be done. Treatment of low testosterone may be done via conservative measures. This includes regular exercise, cardiovascular exercises, as well as resistance training. Now, resistance training improves bone health as well as muscle health, which takes a nosedive when a man has low testosterone. But also eating healthy, managing stress, getting good sleep, All of these combined can help many of the side effects that we see as a result of low testosterone. But testosterone replacement therapy may be given as drugs for persons who have persistent symptoms which are not responding to conservative methods. The drugs are generally given to men who have already completed childbearing because we know that testosterone replacement therapy can act as a natural form of contraceptive for men. Now, the options for treatment may be injectables, which are generally given every 3 months, gels that are applied to the skin or on the axilla, under the arm, injectables that are placed under the skin in the subcutaneous tissue, and even oral agents that are approved can be given for treatment. These are generally effective, usually well tolerated, and should be monitored. Monitoring is done by doing the testosterone levels at least every 3 to 6 months to ensure that they're in the desired range. So this is usually maybe in the mid-teens range. We know that low is if it's less than 10.4, and also checking for other potential side effects, checking the blood count, or what we call hematocrit, to make sure it's not too high, checking the PSA every 6 months. So treatment can be done. For those men who have low testosterone but have the desire to have children, there are other agents that can be given, generally orally, that can maintain fertility, plus also increase testosterone levels. And these patients also must be monitored. I must highlight that there are certain men who should not get testosterone therapy. These are men who have prostate cancer that is untreated or advanced. These are men who have severe obstructive sleep apnea. They really should not be on testosterone therapy. And as we monitor the patients, because we know that polycythemia, which is a condition where there's an increase in red cells in the blood, is a potential with testosterone therapy, we should monitor them closely. So treatment overall can improve not only quality of life, but the length of life. And this has been proven. So there are several myths surrounding low testosterone, its presence, and its treatment. There are some that believe low testosterone is a natural part of aging and men should accept it. And this whole diagnosis and the condition is blown over. In recently interviewing several men with low testosterone and the symptoms, they voiced that they were disappointed that many more of us in the profession were not giving them the time of day with their symptoms. Their symptoms weren't being addressed, the necessary questions were not being asked, and they were being dismissed. And so because of this, many men have a long life where they're affected psychologically, they may develop depression, it can result in breaking up of marriages just because of something that has affected them and affected their general overall health. So low testosterone is not just about sex and sexuality, it's about relationships, it's about family, it's about overall health. But let's just talk about the other myth that just get testosterone, increase your T levels, it's gonna do you good. Testosterone is a hormone that has many beneficial effects, but if at a super physiological or very high level, it can cause harm. Let's talk about a 45-year-old man I saw recently, a diabetic who had erectile dysfunction and sought treatment for his erectile dysfunction. Now, he was offered testosterone replacement therapy despite having 2 readings that were normal. His ED was as a result of his diabetes, which was uncontrolled. What are the potential harms of testosterone therapy in this 45-year-old man? Well, first of all, testosterone replacement therapy can serve as a form of natural contraception. So if this 45-year-old man wishes to have children in the future, he may not be able to have it because of having been offered testosterone replacement therapy. What about the chronic use of testosterone replacement therapy resulting in super physiological or very high levels in this young man? It could lead to what we call polycythemia, where there's a high volume of red cells in the blood. This could lead to a stroke. This could even lead to heart failure and potential death. And then there are other psychiatric side effects of chronically super high testosterone levels. The point is, testosterone replacement therapy is not for all. It must be because levels are lowered, and it must be done at an appropriate time, at least 2 times, and there must also be symptoms. Men should not just be simply treated because they ask for it or because it's the new feel-good hormone. It must be because it is indicated, and in an appropriate setting, the treatment will be given. Low testosterone is a real medical condition which has deleterious effects. It can cause morbidity and perhaps even mortality. So if you have been experiencing any of the symptoms of low testosterone, whether it be fatigue, irritability, lack of interest in sex, erectile dysfunction, Feel free to leave comments or consult us. Have a consultation, let us have a discussion so we can talk more.